Spinal fusion is a type of surgery. It joins two or more vertebrae in your spine. This creates one solid bone. The goal is to stop movement between these vertebrae. Why is this done? Spinal fusion can reduce pain. It also adds stability to your spine. This surgery is often a last resort. Doctors recommend it for serious spinal conditions. These conditions must cause pain and instability. Spinal fusion is a big decision. It's crucial to talk to your doctor. They can help you understand the benefits and risks. Spinal fusion is a complex procedure. It permanently alters your spine. But for many, it brings relief. It improves quality of life. If you're considering this surgery, knowledge is power. Learn as much as you can. This will help you make an informed choice. Spinal fusion is not a one-size-fits-all solution. It is used to treat a variety of conditions. These conditions affect the spine. They cause pain, instability, or both. One condition is scoliosis. This is a sideways curvature of the spine. Another is herniated discs. This is when a disc in your spine ruptures. Spinal fusion can also treat fractures. These are breaks in the vertebrae. Degenerative disc disease is another reason for this surgery. This is the wear and tear of the discs in your spine. Spondylolisthesis is another. This is when one vertebra slips forward over another. Spinal stenosis is also treatable with fusion. This is a narrowing of the spinal canal. It puts pressure on the nerves. Infections and tumors in the spine may also require fusion. This helps stabilize the spine after treatment. The spinal fusion procedure involves several steps. It begins with an incision. The surgeon makes a cut to access your spine. This can be done from the front, back, or side. The location depends on your specific case. Next comes the bone graft. This is bone material. It is placed between the vertebrae. The graft stimulates bone growth. It helps the vertebrae fuse together. This graft can come from your own body. It can also come from a donor or be synthetic. After the graft, the surgeon will use hardware. This includes metal rods, screws, and plates. They hold the vertebrae together. This allows the bone graft to heal. The final step is wound closure. The surgeon closes the incision. This is done with sutures or staples. The area is then bandaged. Recovery from spinal fusion takes time. You will stay in the hospital for a few days. This allows for monitoring and pain management. Pain medication helps keep you comfortable. You will start moving as soon as possible. This helps prevent complications. Physical therapy is crucial. It helps you regain strength and mobility. Your therapist will guide you. They will teach you exercises. These exercises strengthen your spine. They also improve your flexibility. Returning to normal activities is a gradual process. Avoid heavy lifting and strenuous activities for several months. Your doctor will give you specific instructions. They will tell you when you can return to work and other activities. Life after spinal fusion may require adjustments.